The greetings. Me and are going to present a case study on chlamydia. So, greetings of Mahade. So, for today, me and Carmen will be presenting a case study chlamydia pneumoniae regarding a transfusion transmitted disease as our assignment. Um,
Okay, so here I'm going to share with you a breaking news. So patient Thomas was hospitalized for pleural pericarditis following lower respiratory tract infection. He was hospitalized 5 weeks ago and had fever, dyspnea. Chest X-ray showed positive for consolidation on the left upper lobe. 4 weeks after his discharge, the patient presented with fever, shortness of breath, and also pleuritic chest pain, and he was readmitted to the hospital again. Several lab and clinical assessments failed to demonstrate any etiological factor for serositis. Chlamydia antibodies were positive for serum measurements. Chlamydia antibodies were positive and serum measurements showed increasing kinetics for IgG. Okay, today we are very lucky to have Dr. Shruti with us. Hi, Dr. Shruti. Would you mind sharing with us what you know about chlamydia pneumoniae? Maybe give us like a detailed insight and the manifestation of the disease.
yeah, thank you, Miss Carmen. So I will just give you a brief introduction about what basically chlamydia pneumoniae is. So I have been working in blood bank for a few years. So to say that chlamydia pneumoniae is actually a very recently discovered agent in blood bank transfusion transmitted disease. So if we say chlamydia pneumoniae, the first thing that comes to our mind is actually it's a bacterium that can cause respiratory infections like pneumonia, bronchitis, and sinusitis in human. But when you say chlamydia as a transfusion transmitted pathogen, it's not very common, you know. And according to a recent study, it's actually like 1 in a million, and the risk of transmission is still important for the blood bankers to screen for the blood for the presence of this bacteria to minimize the risk of transmission. So, moving on to the pathology and manifestation of chlamydia TTD. So, basically, chlamydia pneumoniae is intracellular bacterium that usually infects the lining of our respiratory tract, mostly our lung and trachea. So once the bacterium enters the blood, it can invade and replicate within the cell, which leads to inflammation and cell damage. In this case, transmission transmitted chlamydia pneumoniae infection. So basically, when transfused, when the blood enters the bloodstream, it actually infect various tissue and organ. So as in like usually this chlamydia pneumoniae pathogen takes 3 to 4 weeks incubation before you can manifest any signs and symptoms. Even if you do, it's very hard to detect. Most people are asymptomatic; they don't have the symptoms. So you will take some kind of test that actually can verify this infection or disease. So the pathological changes associated with chlamydia pneumoniae is primarily related to the host immune response to the bacteria, like I mentioned previously. So the bacterium is going to induce inflammatory response, which can cause tissue damage and lead to development of various respiratory disease like pneumonia and bronchitis. Therefore, some of the manifestation that is caused by chlamydia pneumoniae It's usually vary depending on individual's immune response to this chlamydia pneumoniae. But some of the common manifestations of this disease include the respiratory symptoms, pneumonia, bronchitis, and fatigue. All these manifestations are actually very similar to the when you get respiratory infection chlamydia pneumoniae, which is kind of common, and it's hard to distinguish unless that you take further tests.
Thank you, Dr. Shruti, your for sharing with us what is chlamydia pneumoniae.
Okay, today we have a pleasure of having a researcher, Dr. Carmen, with us. So she will share with us the signs and symptoms first, and she'll talk some things about the transfusion-transmitted disease, chlamydia.
Okay,
Dr. Carmen can
yeah,
continue.
yeah, thank you, Miss Shruti. Hi, I'm the researcher of the ABO University. I'm going to share with you the signs and symptoms of the disease. So by now, I'm pretty sure that you are clear that chlamydia pneumoniae is a bacterial infection that affects the respiratory system. This illness is usually mild and it causes the upper respiratory tract infection. So because it is related to our respiratory system, right? Some of the common signs and symptoms of chlamydia pneumoniae include having a runny nose or stuffed nose, a sinus infection, fatigue, shortness of breath, low-grade fever, hoarseness or loss of voice. The individual may also will have sore throat and slow and worsening cough that can last for weeks up to months, and also headache, chest pain, and however, some symptoms of lower respiratory tract infection include bronchitis and pneumonia. But do take note that it can take 3 to 4 weeks for the symptoms to appear after someone has been exposed to the bacteria.
Yeah, so what do you have to say about the lack diagnosis about chlamydia pneumonia as such that it's very rare? So what tests that can be
Okay, uh, for laboratory diagnosis, a blood test is usually needed, or more specifically, serologic testing. This method involves detecting the presence of antibodies produced by the immune system in response to the infection, which means that the test looks for antibodies to Chlamydia pneumoniae in a patient's blood. The commonly used serologic tests are the microimmunofluorescence assay and the enzyme-linked immunosorbent assay, known as the ELISA test. Besides that, culture is also needed to diagnose chlamydia pneumoniae, but this method is actually quite time-consuming and it requires specialized lab facilities. So another way to get the diagnosis is getting the swab from our respiratory specimens, such as our sputum, nose, or throat swab, to detect the presence of chlamydia pneumoniae DNA. So polymerase chain reaction, the PCR test, is the most commonly used test for chlamydia pneumoniae diagnosis. And other tests required is like the chest X-ray, which evaluate the severity of respiratory symptoms associated with chlamydia pneumoniae infection, which can cause inflammation, pneumonia, and also fluid accumulation in the lung.
so for the treatment, is it the same as treating a normal patient with respiratory chlamydia pneumonia?
For the treatment of chlamydia pneumoniae, there's actually two types. It can be mild and it can also be chronic. Uh, the disease is usually a mild disease and most people can recover without any medication. However, only if necessary, doctor will prescribe antibiotics such as macrolides, which is usually the first line therapy, or tetracycline and doxycycline, and also fluoroquinolones is also another option of antibiotics. But having said that, chlamydia pneumoniae can also be chronic. So especially for high risk groups like young children who are below 5 years old, the elderly above 65 years old, or immunocompromised individuals, for example, those who have autoimmune diseases or HIV patients, and also people living with underlying respiratory conditions, smokers, and also community acquired or people who have close contact with the infection. So serious complications may develop in these groups of people, and hospitalization is needed, such as worsening asthma, encephalitis, which is the swelling of the brain, myocarditis, the swelling of the heart, arthritis, atherosclerosis, which is like the plaque built up in the arteries, and also neurological disease, which may lead to death.
Thank you, Carmen, for the insight of your research regarding chlamydia pneumoniae, and I hope you will continue to publish more literature and study on it, since it's kind of a very rare PTD. Okay, to close off our interview about transfusion-transmitted chlamydia pneumoniae, I want to say that chlamydia pneumoniae is bacterial infection or transfusion-transmitted infection. Is one of the three species of chlamydia genus that can cause transfusion. So often as bacteria other people through all that which in return develops into chlamydia trachomatis. But in this case, we're just talking about transfusion, which is through bloodborne. And therefore, it is important for us, for anyone that has been contact with this disease, to be screened uh, blood donors for the presence of bacteria to minimize the risk of transmission to blood transfusion. Thank you.
Thank you.